Hi, my name is Sharon Classen. I am a physical therapist and athletic trainer, and I'm also certified in equine rehab. I travel all throughout the country and all throughout the world, and I treat elite equestrians, both horses and riders. So I treat both the humans individually and the horses, and then also evaluate the biomechanical interplay between horse and rider. With the humans, they might have biomechanical faults, they might be weak on one side, they might have some hypomobile segments which cause them to ride asymmetrically. That generally transmits and can cause subclinical or pathological changes in the horses. I see the horses that might have a problem as well, and that transmits into the rider. To keep it in the most simplistic terms, if I can make the rider as fault-free and as functional as possible, and the horse as well, and they're together, that will only improve performance, increase longevity, and prevent injuries. For example, if we have a rider that has a low back injury and the horse is jumping over the fence, the rider might have a tendency to shift to the right to compensate for any pain that they might have. The horse will then, upon takeoff, perhaps swing to the left over the fence, and if that's the case, that's not the correct form. So when I work on the rider and get them so they're biomechanically correct, then I have seen that the horse also then jumps with correct form over the fence. I can see now what is happening now, the movement in veterinary medicine is they're very interested in sports medicine. The basic four things are prevention, maintenance, rehabilitation, return to sport, and performance enhancement. So those principles have been utilized in human sports medicine, and personally I'm very familiar with them. So to take those principles and introduce them into any sport in the equine world is something that I have done myself personally, but is something that I've seen the positive outcomes. And I think for me and for all of us that are in this, it's very exciting times for a vet and a physical therapist to work together with all the other ancillary services that are needed for these animals to improve their, like I say, to improve their longevity, to say that horse perhaps is going to have a suspensory ligament or there's something we should watch for on that. They do that in human sports medicine, and now we can do it in equine sports medicine as well. So I'm very excited about that.